and a very warm welcome to our podcast today. Today, our health topic that we are going to look at is PCOS. I'm sure हम लोगों ने PCOS, PCOD, we have been hearing in the last 10 years तो बहुत ज़्यादा हम इन चीज़ों के बारे में सुन रहे हैं. And if you look at the data, 1/3 of the women around the world are suffering from PCOD. PCOS has still lesser number, and today we'll understand the difference between the two as well. Mostly women in 20s, the range of 20s to 30s, ये बहुत जल्दी ये girls को और ladies को ये particular problem आ जाती है, and it is something which is more like a lifestyle disorder, which we'll understand more. And modern medicine इसमें बहुत ज़्यादा successful नहीं रही है. Today we are having a distinguished guest, a homeopathy doctor, who is going to give us share her insights about how homeopathy can wonderfully work on PCOS and PCOD, both for preventive as well as curative. So a very warm welcome, Dr. Shilpa Acharya. And introducing ma'am, Dr. Shilpa Acharya Dharwadkar is a homeopathic doctor in Pune. She has 15 years of experience in practicing homeopathy. She practices at Baner, Pune. So we know if we want to consult her, we have to in person go to Baner, or we can always consult her online as well. So ma'am, to start, the basic question, what is PCOS and what is the difference between PCOS and PCOD?
Yes, it's a very good question to start with because there is a big confusion regarding these two. So let me go to the basic first. Okay, as much as we understand what is a disease and what is a PCOS is polycystic ovarian syndrome, whereas PCOD is polycystic ovarian disease. See, in medical terms, yes, we can differentiate it very well. But for a person who is a layman or the people who are listening me out over there, for them, there is a very minute difference in both these two. Okay. So now when we coin the term disease, it means that there is a definite causative factor to it. That means when you know that certain thing is causing this, then you say this is a disease because of this. So for example, if a person is having leprosy, so you say that bacteria, Mycobacterium leprae has caused leprosy. And then you have a certain cure for it. When you say that the blood is not having any more leprosy bacteria, that means the person is free of leprosy. So this is how a disease is coined in medical term. Okay. Whereas a syndrome is a cluster. Okay. It is a cluster of symptoms. It is a cluster of hormones, and it is a cluster of organs which are involved into a particular disease that is happening to that person. Okay. And in PCOS as general, we are yet to understand why it is happening. As madam has rightly said, now it has become very rampant. Initially, when we were learning in our college days, it was very, very minimum. We used to have that percentage as 1 to 2% only. And now it is, in India itself, it is becoming from 3.5, it has gone to 26.6%. So the reason why this is happening is still unknown. So we are yet to find the reason for it. There can be various etiologies that has been assumed. One might be stress, one might be changing lifestyle, the way we are having our food, the dietary changes, all these are leading to it. But yes, we are not yet certain why exactly these changes are happening. Why is it that today's female do not get their menses normally, which is not the case in, at least 3 decades back, this was not the case. But in this past 3 decades, it has gone very high. So the basic difference between PCOS and PCOD is, one is PCOS is a syndrome. So when you talk of a syndrome, there has to be more than 2 or 3 symptoms or diseases that have to be coordinated in together. So in PCOS, the number one thing is polycystic ovary. That means the cyst, there is an ovary, which is a reproductive part of your female body. So there are a lot of small cysts, water-like bags, which are developed onto the ovaries. So this is called as a cyst. So ideally the ovary should have a clean surface. In polycystic ovarian syndrome, there are many small tiny bags which are placed. So that is how it is called as polycystic ovary. One. Secondly is increased hormonal levels, male hormonal levels that are called as androgens. So primarily is testosterone in this, which is increased to the level of what it is not expected in a female body. So this is the second thing that happens. The third thing that is happening is because of all this, the menses are either scanty. In certain patients I have seen there are no menses at all. though they have all the secondary sexual characters. They have developed breasts, they have developed the hair around the genital area, but there are no menses. One, or there is oligomenses, that is very scanty menses. Once in a while they get their periods and the flow is very, very scanty. So these are the basically 3 to 4 criteria which the person should meet to call him as polycystic ovarian syndrome. Okay, now what happens is not all the females of the 26% that we talk are passing through this entire syndrome. Some are just having certain polycysts on the ovary, that's it, with or without any menstrual irregularities. So then we are terming it as a disease, because here the metabolism or the endocrine axis is not involved. When the endocrine axis is involved, that which you get it done from the hormones that study in the blood. That is, in short, when the male hormones are more, you get to see it from the blood study. Then you can label it as PCOS. But when such a thing doesn't happen and only the ovary is showing certain cysts, so then it is labeled as PCOD. So that is how it is shortly, yes. So one, the severity of the disease, that is how accordingly we have differentiated.
Okay, great. So I think, just now that we understood, some symptoms which you start seeing in a syndrome means a set of symptoms. So what we want to understand, and it is one of the data points that we have, is that according to WHO, 70% of the affected women are undiagnosed. So उनको पता ही नहीं चलता कि we have PCOS, PCOD. I think till the time they try to get pregnant, they don't understand whether they are suffering from this. So what are the symptoms? And one more data point says that a lot of other health conditions come to people who are already suffering from this. So now we want to understand what are the common symptoms of PCOS and PCOD, and how can we get those red flags, being a woman or a girl, that we should get ourselves tested or diagnosed.
Right. See, PCOS or PCOD, whatever, the symptoms first in primary symptom at any age group. It can happen at puberty, in between of your reproductive life, that is between 20 to 35, or even during your menopause, nearing the menopause is oligomenorrhea. That is, the menses are scanty or there are no menses. Or sometimes when the menses come, the patient starts bleeding very heavily. So that is called as DUB, dysfunctional uterine bleeding. So all these three, if it is following a pattern, if it is persisting for a long time, then think about getting yourself tested. Okay. The second symptom that comes up in this is obesity, which is the most important symptom of all. The obesity shows that the person has a lot of abdominal girth. The abdominal girth is so much that the person also treats of social stigma because of it. That is the weight increase in the weight. Then the third symptom is hirsutism, or you can say hair growth on the parts which are not actually ideal for hair growth. So like on the chin, upper lip, facial hair. So like beard like symptom which come up. So because this is primarily increase in male hormone, so certain features that come up make me feel that you are a male rather than a female. So that's the third symptom that comes up. And fourth is hair loss, excessive hair loss, and the hair for loss is where with alopecia. Alopecia means bald patches, especially on the scalp area, because females do not have bald patches at any age. But then in this, even in pubertal girls, you see that the hair loss is very heavy. They have that bald patches. They don't have a good hair texture. So this is another symptom. So all this symptom together should give you a warning sign, that I'm not getting my periods regularly. 9 out of 12 periods, if you don't get regularly, then it is a really very, very important this symptom that you are suffering from some disease. Second is irregular bleeding, wherein heavy bleeding or less bleeding. And the third symptom is hair loss, which should be excessive. Slight hair loss, no need to panic, but excessive hair loss with bald patches. And yes, definitely male type hair growth all over your body.
Yeah. Now, next, so I think that's absolutely something which we should get the red flags about, being a woman and a girl, that not to wait only when we are trying to get pregnant and we don't get, but any of these symptoms that you just mentioned, if we are, facing any of this or even slightly, then we should just kind of get ourselves diagnosed or tested for that. So
Right.
now moving on, I think there are certain myths and misconceptions about PCOS and PCOD. So I would like to go through each one of them. You can tell me whether that's actually a myth or a fact, and we would also ask you to add some more if they, people have misconceptions which they think कि हाँ, ये है तो PCOS हो गया या फिर इससे ठीक हो जाएगा. So now, first of the most important things which people feel कि अगर आप if you lose weight, you can get rid of PCOS. Is it a fact or is it a myth? Like weight.
Losing weight is one part of the treatment of PCOS. But
Right,
yes, that cannot be the treatment for PCOS because it
right,
is a metabolic disorder. The
right,
hormones are gone into jolt. So you need some measures to correct it. The hypothalamus, pituitary, and the ovarian axis is somewhere disturbed, because that is why I told you it's an endocrine disorder. It's a metabolic disorder. So just doing one part of diet or reducing your weight may not help you completely.
right. And that's, I think, the most important which people have is you can't get pregnant if you have PCOS.
No, it
Is
is a
it?
big misconception. Yes, pregnancy becomes a bit difficult, but it is not impossible. With good amount of treatment, regular exercise, and diet, it is completely possible.
Great. And PCOS only affects overweight women. Is it true?
That is the biggest myth, because that is why I see so many patients, in my clinic, who come and say, I'm not overweight, especially young girls, and then they say, I don't have PCOS. That means it is a big misconception, because nowadays there are two types. One is with an increased weight and one with a normal weight. So that can happen with normal weight also.
Right. I think the way you described that there's so many point of failures in the body for having this that cannot nail it just to one. But yes, they could be
Mm.
all adding to us having that particular disease. So I
Right.
think, yeah. So moving forward, are there specific? I think this is the most important, takeaway from this session that we want is that first it is a lifestyle disorder. Basically, our
Yes.
lifestyle has gone for a toss, and that is why we are facing this disease. And I always tell that on Nature Fit, our whole objective is to get people to understand that yes, there are alternative ways of first why the lifestyle disorders happen and what are the different ways that we can treat it, and the most important is to take care of your lifestyle. I think that
Exactly.
in the name of the disease only we have the solution that you have to put your lifestyle into order.
Yeah.
So now we would like to understand that what are the specific dietary or lifestyle changes which can actually help in, one is preventing PCOS, and if somebody has PCOS, how can we, help? Yeah.
Yes, yes, yes. Thank you. That's one of my favorite topic, and I think the tagline of the entire generation today should be that change your lifestyle. It's high time that we change our lifestyle, because the younger generation, I would start with them, eating habits, of eating junk food, eating lots and lots of refined flour, or we call as maida in short, and this cheese items that they put on top of it. This is all actually the junk, and on the top of it you bake it over for a higher heat. You bake it in the oven, you bake it in this bigger microwaves, and this thing. This is the main reason why we are facing so many problems, because this is just not a healthy diet. You know what, just out of the way, my daughter keeps telling me that, I've seen on the television, she's still so small, she's in first standard. She says, you don't allow us to have pizzas regularly, and you see those Italy people, they keep eating pizzas, right? So I tell her, it's a good question, I told her. But do you know, I said that we are Indians, right? I told her, see, an Italian is an Italian, we are Indians. So everybody has a region, everybody has a small country, everybody has a small space. In India also, we have North India, South India. So we have certain things that are local to us. I wouldn't, put it under a banner of, eat this antioxidant food, super food, take this smoothie, take that. No. First and foremost is to understand that your body needs are local to yourself, so local to the place where you live. So when you are living over here and you're staying over here, don't adapt too much to a cuisine which does not belong to you. So if you're an Indian, our roti sabji is the best thing. Yes, if you go to Italy, have pizzas, no issues. but not make it your staple food being in India. So the first and foremost I would suggest to everybody is to start being local. Whatever is grown local, whatever is available local is the best for you. Now the food that or the nutrients that we require for PCOS, that's a big question, because what is important in a lifestyle disorder is less amount of antioxidants or less amount of fresh foods that you're not eating. So that includes fruits, green leafy vegetables. Nowadays we have green leafy vegetables as well as cauliflowers that we get in the form of broccoli. You get red cabbages. These are all certain different things that you can involve in your daily diet, and these are very rich in antioxidants. When you talk of fruits, eat all the fruits that belong to that season, that belong to that particular region that you're staying in. So being in Maharashtra, have or being in India, I can say have a lot of mangoes. They are really local to us and they are really delicious. So in that time people have that diet craze and they leave certain good things. So first and foremost is stop crazy dieting, eat healthy foods, and eat food at time. The most important of all is have a healthy breakfast. People in our generation want to skip the breakfast, directly have want to have a brunch, and then directly dinner, which is very late. So wrong lifestyle is this, where you're not having a pattern of eating, drinking, as well as you're not having a time for your food. So this should be avoided first. Secondly, yes, as every doctor says, stop, avoid oily foods, avoid all street foods. That is there, yes, but I would say that you can have it once in a while, because your tummy also requires something change. That is, let that be a change. Let that not be your daily lifestyle. Okay. Yeah.
Yeah. So perfect, and I think the most beautiful, like whatever sessions we have had, we've spoken to so many doctors. This is something common for all the diseases, that whatever we do, and that is the difference between modern medication and a holistic approach to healing, where we do not only heal you for that particular disease for a particular time, and then you again it will come back. So when you are changing all of that you mentioned, only then you can actually stay away from the disease. Otherwise it will, जैसे बोलते हैं ना, जिम छोड़ा तो वापस वेट आ जाएगा, वैसे ही आपने अगर आपका, so I think that's very important, that lifestyle changes for any diseases which are we are hearing today is very, very important. Diet, as you said, but in the new generation it's very difficult. But I'm sure the elder ones can understand the importance. The 20s and above, they can understand the importance of that. Okay, so moving forward, now we look at how homeopathy takes, what is its approach, and a very, kind of an again interesting, data point that I want to share. That Central Council for Research in Homeopathy, CCRH, has released 2 case studies of patients suffering from PCOS. It actually, they basically had a samples where they, there were people who were who went through the oral contraceptive pill therapy, and there was a set of samples which was actually put into the homeopathic approach to the management of PCOS, and there was a much better result. And especially this, they kind of correlated that people who have PCOS also face from depression and anxiety, which is very common, because they are, there are so many things which come with any disease. So that a homeopathic approach was more successful in treating PCOS. So that's kind of a study which has been done, and now we would like to understand from you that what is the homeopathic approach to treatment of PCOS, and why it would work better than the other modern medicine or any other therapy. Yeah.
Yes, yes. Thank you. Thank you. That is my subject. So, coming back to homeopathy,
Mm.
first let me introduce what homeopathy does. Okay, what is homeopathy? So, basically, homeopathy was founded by our Dr. Samuel Hahnemann way back in the 18th century. It was at that time that he, see, today we are talking of LSD, that is lifestyle disorders, but he has proposed and he has written lectures and books on what can happen to the future generations, and based on that he has really established such a beautiful system way back in that. We are in 21st century today, but still it holds true. So let me just give you a small example, okay, so that examples make things easier. I'll just give you a live example. Okay, I had a patient. Okay, there were four sisters who used to come to me, and all of them used to take treatment for me. The fifth sister who was there, she was absolutely healthy, and she never contacted me for any illness. But these four sisters were my regular patient. Now there was one, two of them suffered from PCOS. One was suffering from severe diabetes, and the fourth one was suffering from something like migraine and headaches. So these were the four diseases that these sisters were carrying. So when I understood what exactly went wrong, so there was an environment. What happened was in their childhood, Indian family, traditional Orthodox Indian family, they wanted a son. And so four daughters were born. Then the fifth daughter was also born. So the father was always disappointed right from the day one, from the first childbirth. He never took up any child, never hugged a child, or never, even caressed a small little baby. So that is how they were brought up. Mother was equally frustrated, and there was a huge financial burden on them. And they belonged to some community where marriage was a big expense. So five girls to be married, they would be under continuous tremendous pressure. So what they did was finally was, compensated on their education, compensated on their wishes, and just got them married off. So this is a situation, all these five sisters were there in the same situation. None of them were out of it. And all of them chose a different body language to show this stress of theirs. The stress is the same, right? So one is having a stress, one is having PCOS, one is having migraine, one diabetes, and one disease free. When I studied this, all of them had come to me. So when I studied this, I realized, see what Hahnemann had beautifully written around 250 years back, that the situation given is the same for many. Even we are today in a situation where the lifestyle disorder is something which is a package for us, right? But how a child or how a person adapts is completely different. So one sister who was healthy had chosen the best of the adaptation. Is she had her own way of coming out of it. She got educated post marriage. She did her own thing, and she did a wonderfully good life. She led a life. Remaining four, somewhere or the other, were in grief, depression, anxiety, insecurity. You can say all these things were there. So this is how homeopathy helps. So if I give you any medicine which will just treat your hormones, it is not going to help. Or maybe to a certain extent it might help. But then the stress or the insults that were there from the childhood, if those remain, then my process will become delayed. The moment you stop the hormones, again I'll get back to my condition. Again, there it is. So that is why there is a recurrence when you take certain treatment. If at all the root cause, this is what is the root cause. The root cause was the wrong thought process in which they have developed themselves. So this is how, and when I treated that cause, that insecurity, that depression, believe me, the PCOS completely disappeared. They are still with me. If at all there is any stress or anything, there might be spurts again, but it helps them, and they are so happy. They have reproduced also without any difficulty, and they are doing extremely good. So in short, what I want to say is, there are certain, comments, why homeopaths take so much time. One of my patients told me that my husband also didn't ask me so many questions that you have asked me till today about my personal life. I said, yes, because I need to treat you. I am not here to marry you. So that was one of the things. So what we understand by asking you the history or by asking you the symptoms is we go to the root. Why at all the diseases happen. Right?
True.
And this cannot be discreted in one line. For somebody, it might be an insecurity. For somebody, it might be something else. So every person is different. Every person's remedy is different. This is how homeopathy helps. So this is most important part of homeopathy. I think that's the best way to explain it out.
Yes, yes, absolutely brilliantly explained, ma'am. And that's what I feel, that the miracles of these sciences is to get to the root cause. I feel all the diseases that we are having, they are just a physical manifestation of what is going emotionally, mentally in my body. Yeah, there could be, the food that I'm intaking is one of the very important thing, but most of the other, 90% of the diseases are psychosomatic. And I think homeopathy is a perfect blend of treating the physical as well as the psycho part of, and trying to identify. And even the same thing for me, I have never answered so many questions to anybody but a homeopath. So even my best friend
Right.
doesn't will not know what my homeopathy doctor knows. And I think
Right.
that's beautiful. That is how you actually target. And then there is a lot of counseling along with the
Yes.
medication, which goes and which makes it a perfect kind of a treatment or a therapy to take. So thank you so much, ma'am. And our mission on Nature Fit is to take such therapies to people, make them aware that, see, modern medication will leave you with eating the medicine till your deathbed. You are getting cured, but you are going to be dependent on medication, and it is just a treatment of a symptom. But these therapies that we are having here on Nature Fit, you are promoting the fact that you need to treat from the root cause. Only then you can be call yourself cured.
Right, right.
So
That's true because see what I have seen in this generation is that they are happy they're not getting their menses. But we should realize this thing that it is not a happy thing not to get your menses, right?
right.
Because it is an endocrine disorder. Today it might be only with menses, tomorrow it might start with diabetes, hypertension. So we should be aware that there are certain dangers of this disease in itself.
Absolutely, absolutely. And not getting menses, I think that is the most important detoxification process for our body as a woman. And if it doesn't happen, it will again manifest into some other form, and it will be like PCOS, PCOS. So all of these are
Right.
that manifestation if we are not having these regularly, any natural process not happening. So I think thank you so much. Thank you so much, ma'am. It was really a good interaction and understanding the actual disease, why it happens, the symptoms, and how we can take care of it. So people now know that who want to get completely treated, they can consult Dr. Shilpa. She's at Baner, and we have shared the profile link in the description. She can be contacted and consulted online as well. And please subscribe and like the channel as well, so for more such health related, lifestyle based, root cause based changes in and taking a different approach to your health. So thank you so much, ma'am. Thank you for joining. Thank you so much.